We are live.
All right, thank you very much. Good morning and welcome to the Legislative Committee on Administrative Rules, May 15th, 2025. Apologize for getting a late start here, but we didn't have a quorum, so we couldn't get started. Someone grab the door. Awesome. Thank you. All right, so before we get started here, let's do introductions. I'll go to my left.
Rob Plunkett, Senator of Bennington District.
Scott Beck, Senator, Caledonia District.
Larry Sutcliffe, Representative from Randolph.
Carl Ellie, Representative Burlington.
Good morning, Senator Dave Weeks, representing Rutland Council.
Damian Leonard, Office of Legislative Counsel.
And Representative Trevor Squirrel, and I represent the Hill and Jericho.
Emery Mathias, Committee Assistant.
Okay. First item on the agenda are the minutes from April 24, 2025.
Accepting those minutes.
Okay, Representative Odie has a motion to accept. Any discussion? Edits? All those in favor, please say aye. Aye. Opposed? Okay, thank you very much. First on the agenda is Rule 24P43, Administrative Rules for Peer Support Providers Certification and Peer Recovery Support Specialist Certification. Speaking for the states of Secretary of State's Office of Professional Regulation. Emily, is it Tredo?
It's Trito.
Tredo. Welcome.
Good morning, all. My name is Emily Trito. I'm a staff attorney with the Office of Professional Regulation within the Secretary of State. These are administrative rules for a profession that last legislative session, the General Assembly newly deemed should be regulated as a certification. Within professional licensing, there are three types of professional credential offered in the state. There is a registration, which is a type of credential that anyone can obtain that requires no particular qualification, but for which you must be registered in order to practice that profession. An example of that is massage therapy. Then there's certification, which is what these rules would implement, which is an optional credential that requires qualifications to obtain, but is not required in order to practice that profession. So a person could engage in the practice of peer support without being a certified peer support specialist. But in order to call themselves a certified peer support specialist, they require this credential. And in this situation, as in others, that's often something that's created by the state in order for those individuals to qualify for Medicare and Medicaid reimbursement and other insurance reimbursements. And then there's full licensure, where a credential is required for any practice of that profession and where certain qualifications are necessary in order to obtain that credential. So this is one of the sort of mid-level types of regulation. I should add that I'm here along with Jessica Schifano, Nicole DeStasio, and Nicole Rao, who are from the Department of Health and the Vermont Department of Health and the Department of Mental Health. They did a lot of heavy lifting in drafting these rules and are going to be close partners with OPR in administering this system. They are going to be the departments issuing the credentials for these individuals. So OPR's role is really to carry out the licensure process, since we have the regulatory apparatus to do that, and it's what we do, rather than those departments needing to build their own systems. But in terms of the substance of what is required ethically of certificants under these rules and what is required to become a certificant, they are writing the substantive policy and implementing the code of ethics and drafting the codes of ethics for these professions. So that's my introductory spiel. If anyone has any questions about these rules or concerns, I'm happy to answer them or to defer to colleagues from those departments if they're better positions to answer them.
Committee members?
Did the committee chairs acknowledge that the rules met the intent?
The chair of House Human Services, Representative Boyd, did say that it meets legislative intent.
Thanks.
Not hear from the Senate chair. I have none. And do any of the other folks here representing other departments wish to comment at all? Okay. I have a motion. Senator Weeks.
So I'll move that we approve 24P43, Office of Professional Regulation, Administrative Rule for Peer Support Provider Certification and Peer Recovery Support Specialist Certification.
Senator Weeks has put a motion on the table to approve. Any additional discussion? All those in favor, please say aye.
Aye.
Opposed? Thank you.
Thank you. I'm just gonna stay in this chair for the dental rules.
All right, the next rule up is Rule 24P44, Administrative Rules of the Board of Dental Examiners.
Yes.
Can I make one? Can you speak up just a hair?
Sure.
Lower is a little.
Okay.
Actually, why don't we turn off these machines temporarily?
I think it's the.
They do create this background.
Oh,
Yeah.
Thank you.
Problem solved.
thank you, Senator.
So I'm still Emily Trito, staff attorney from the Office of Professional Regulation. These administrative rules would update the Board of Dental Examiners rules that haven't been updated since 2010. And these proposed rules have been in the works with our board for several years now. The major changes in them are implementing rules for the licensure of dental therapists. Dental therapy is not so new, but new to Vermont, sort of mid-level credential. It's someone who can do some of the activity of a dentist, fillings, some restorations, but has an education and a scope of practice that is less than that of a full dental, full DDS or DMD. It's something that is conceived as a credential one can go on to obtain after becoming a dental hygienist. So a dental hygienist can do 2 more years of school to become a dental therapist. And it's a mid-level profession that was conceived to try and fill a gap in the profession, in the community, since there's a lack of practitioners. And it has been implemented in some states with great success, and especially out in remote areas like Alaska and some reservations within the US. So several years ago, the General Assembly created that within Vermont. This is our first rule update since doing that. So this is when we're laying out the details of how to become a dental therapist and what the scope of practice is. So far, we've only got one licensed dental therapist who's licensed in Vermont, and they don't live in Vermont. So the theory that if we build it, they will come has not yet panned out. But if they do, then we've got a regulatory apparatus ready to go for those individuals to start practicing in Vermont. The other significant policy move in these rules is implementing another choice of the Assembly from 2 years ago to permit public health dental hygienists to employ a certain type of therapy in public health settings. And public health settings are mostly schools through the 802 Smiles program funded by the Department of Health, also prisons, nursing homes, populations that might, for insurance reasons, transportation reasons, have trouble accessing traditional dental care in a dental office with a dentist. And so these rules implement a statutory mandate that OPR create rules for those public health hygienists to be able to use certain types of therapies for addressing cavities, which normally is not within the scope of practice for a dental hygienist. And this is for dental hygienists who've been licensed for 3 years, who are practicing in these specific settings, who would be required to have undergone a training approved by the Department of Health, and would be working under the general supervision of a dentist, not on site, but through a general supervision agreement. Apart from those sort of new policy initiatives within these rules, they just generally streamline the old rules. They're much shorter, hopefully more readable, and they take a more general sort of standards of care approach rather than being as prescriptive as our current rules. So for example, with the sedation and anesthesia specialties available to dentists, those are already part of our current rules, but instead of laying out here's exactly how you do this type of procedure, here's exactly how you do that type of procedure. It references guidelines promulgated by the American Dental Association. The theory being that those are going to be updated more frequently than our rules necessarily will, and we want the rules to remain to automatically be current as the field updates itself and becomes more current as the standard of care changes, rather than mandating a particular standard that over time will no longer be the standard of care inevitably as medicine progresses. So that's those are the highlights of these rules, and if anyone has any questions, I'm happy to answer them.
Committee members? I did have a short conversation with council before we got started. There were, I wouldn't call this rule controversial, but there certainly were a lot of comments that were submitted around this rule. And no one chose to come and offer testimony around some of those comments. And your response was that for the most part, that those were addressed because it was in statute.
Yes, I'd say the most controversial, not I think part of the rules themselves, but change in the regulation of dentistry in Vermont is that public health hygienist role that has been created. And there was still some pushback during rulemaking on that idea that someone other than a dentist could be addressing cavities. They're called caries in the rules. It's a term of art, but to most of us, cavities. But that is very clear. This is carrying out a clear statutory mandate. So it would have been inappropriate in rulemaking to be second guessing the legislature at this point. But that underlying decision was somewhat controversial. OPR fully supports what the legislature did in 2023, authorizing that role. We think it's an important public health move to address previously unaddressed access to dental care for mostly low-income children. But that was the sort of biggest flashpoint in the past couple of years within this regulation.
Thank you. Representative Odie?
Thank you. So how were you able to address the concerns about training and experience actually doing the work on cavities?
Yes, so the General Assembly mandated that anyone doing that first has to be licensed as a hygienist for 3 years and has to undergo a training approved by the Department of Health. And that this wouldn't start happening until these rules were promulgated. So we would defer to colleagues within the Department of Health for that appropriate training. Someone doing that also has to be under the general supervision of a licensed dentist, which puts a significant incentive on that dentist to be supervising them and aware of their training levels. And they also are still subject to the standard of care and subject to this professional discipline if they fall below that standard of care. The type of therapy being authorized is called SMART. It's silver modified atraumatic restorative technique. And it essentially is something that has already been done with success in Vermont. It's been used for many, many years in Japan and Australia. And it's essentially a way of treating a cavity by first applying something called silver diamine fluoride, I believe is what SDF stands for. And that arrests tooth decay. And public health hygienists have been using that in Vermont for years now. But that the process of doing that becomes black on the teeth. It can be disfiguring and is mostly used on baby teeth or the teeth of people in their 90s or someone who, for whatever reason, can't tolerate being in a chair and having a cavity drilled out. And so SMART is basically SDF plus a glass ionomer that looks white and more or less shiny and more or less the color of a tooth and is hard, and is a way for someone to have SDF without it being as visible on the teeth. So if someone has tooth decay, they won't have that has been addressed through SDF, they won't have a healthy but now black tooth visible. And so that's part of why OPR is not concerned about a safety dimension for this, because the therapeutic part of that technique is something that has already been used by public health hygienists for some time now. And SMART would add on that, but it's mostly a cosmetic addition to that technique. It's not a new underlying therapy for treating the cavities. The rules also require that a public health hygienist inform a patient or a patient's parents when they receive this treatment that they should follow up with the dentist, because not all cavities are appropriately addressed through that technique. Although I should say the rules also require them to make that judgment call and not use these techniques if it's not appropriate. But to follow up and seek a dental home is the term in the field, and to seek out care with a dentist. The requirement that they give that advice does not suddenly, create dental coverage. So, but it's a move in the right direction, hopefully, allowing people to have some type of mid-level therapy and not have it be an all or nothing. You're seeing a dentist, you're paying for a dentist, or you're getting no care at all.
Thanks.
No problem.
Any other questions? I have a motion.
So moved. Find the right wording.
And the date of the amendment was May 13th.
I move that we approve 24P44 Office of Professional Regulation Administrative Rules of the Board of Dental Examiners with proposed modifications submitted by the department on May 13th, 2025.
Okay, we have a motion to approve as modified, as amended by Representative Bodie. Any additional conversation, discussion? All those in favor, please say aye. Aye. Opposed? Thanks a lot.
Thank you.
Much appreciated. I have two other quick items on the agenda. Well, they're not on the agenda, but I'm adding them. We had some outreach from Forest Parks and Recreation a while back around a rule called heavy cut rule. And and we had some review done by our council. Katie, thank you very much. And also more of a subject matter expert and Michael agreed with this. And then we made a recommendation back to Forest Parks and Rec about this issue. But I asked sort of explain that conversation just so that you're aware that we had gone through this process. It wasn't something we brought to the committee. With you.
So I think to take you back, back in 2016, I believe, we passed a law that basically amended part of the APA to say that any rules that weren't published in the Code of Administrative Rules by July 1, 2018 would be repealed by operation of law. And so we heard from Forest Parks and Recreation a while back that they had not been aware of this. And the heavy cut rules have remained on their website and been used. And I should say it's a procedural rule for the most part that governs. Is anyone here familiar with what a heavy cut is? Okay, so basically there is a standard that the U.S. Department of Agriculture puts out for basically the remaining stock of trees in an area that's been cut. And they have different lines where they sort of show like the amount of trees left. And if you get below a certain level called the C line, and you're over 40 acres, you trigger the heavy cut rule in Vermont, which basically means that you need to give notice to Department of Forest Parks and Recreation of your intent to do a heavy cut. And then they need to authorize the heavy cut. And they have basic silvicultural standards that they follow, which are promulgated by USDA and incorporated by reference into the heavy cut rule. And then there are various exemptions too for when the cut is okay and you don't need approval from the department. But in any event, this rule, which is, it's only a few pages long, most of it is taken up by an application form and then cross-references to those USDA standards. In talking to them in the past few months, we discovered that it had not been published. So the effect is that they've been administering the rule since July 1, 2018, as if it still applies, issuing authorizations for heavy cuts. They have not taken enforcement actions, as we understand it, on the basis of the rule. They have taken enforcement actions for violations of the underlying statute, but not the underlying rule itself. So they have reached out and in reviewing it, because there isn't an issue of someone's rights having potentially been affected, and there are no pending cases challenging the rule, it is possible to retroactively basically validate and say the rule is deemed to have remained in effect since that date. And it basically would leave everybody who's been subject to it and has filed their authorization form, et cetera, in the same place as they are right now. So there is language that has been drafted that they are asking committees to include in one vehicle or another to get across the line. This session, I don't know if that's going to happen. It's very late in the session. But it would basically say that the rule was not repealed. All of the authorizations issued are valid, and they shall publish the rule within 1 year from the effective date. So it would get into the code of rules at that point. If they don't do that, or if it doesn't pass, their other option is to basically adopt the rule. And it's the rule is a funny one. It's a rare instance where in 1997, when it was adopted, the legislature said adopt it as an emergency rule, and the emergency rule shall remain in effect unless and until it's ever amended. And it's never been amended since 1997. So it is a essentially permanent emergency rule. And I think that's part of why part of the confusion that arose around the rule when we had this repeal by operation of law. But in any event, there are 3 bills in the Senate that they've been speaking to chairs about having the language added to. I don't know if that'll happen since we're in the final weeks of the session, but it is something that may come back to us as a committee. Do you have questions?
Thanks, Dean. The other issue is, well, I think some of you have been around when we did this. A few years back, we had a conversation in this committee about rulemaking as it applies to what's put into bills and what passes. Whether rulemaking should occur, whether there's a shall or may attached to that, whether there are dates attached to it in the legislation. And because I think there's a real question about no one really knows or is not following or tracking what's happening year to year. As legislators, we tend to keep moving forward and looking forward. We don't always go back and take a look and see what we've done and whether agencies and departments have complied with legislative intent around that. So I think it was about 2 years ago, maybe it might be 3 years now. You know?
I think the conversation started in 2022.
Yeah.
And then the first chart that Anthea created started in 2023.
So I think at the end of a session, someone was tasked with putting a chart together that captured all the bills that have passed and all the requirements around rulemaking. So this chart exists.
It does. Yeah, so this is something that Anthea did before she left, and it's something that I didn't realize was on my task list when I took over the position last summer. So we do have a chart from 2023 that Anthea provided, and it essentially sets out the year of the bill, the act number, the section in the bill where there's rulemaking authority, and then what the topic of the rule is, who the committees of jurisdiction are, who the adopting agency is, whether the rulemaking authority is new, whether there's a mandatory language in there, like you shall adopt rules on or before such and such date, and then additional notes kind of explaining what the rulemaking authority was. Sometimes there's no mandatory rulemaking authority, but the agency's authority to adopt rules has been expanded. And so they can now adopt rules on a new topic. In another case that I came across while I was starting to work on this, and unfortunately I haven't managed to fully update it in the last couple of weeks, given how busy things are. But one of the things I came across is we actually took away rulemaking authority from an entity in 2024 that hadn't used the rulemaking authority and didn't want it. It had just been included in their enabling act. And they came in and said, we have no intention of ever adopting rules related to what we do. Can you take this out of the statute? And so we did that as part of an act that I worked on. So this basically tracks that. And the other thing it does is, as you'll all remember, we had that 2-month period this session where nothing was coming in. And Emery and I had no idea whether we should be expecting anything. All we could do is reach out to the Secretary of State and say, are there rules that have been filed that are in the hopper, or is this what's going on right now? And Louise Corliss at the Secretary of State said, yep, there are rules that are in process, but we won't know, until they get the final proposed rule when they're coming in. And so this will give you that information too, so you'll know at least we have 2 or 3 rules that are due in the next month or the next 6 months. And then there may be other rules beyond that. But yeah, as the session winds up, I should have more time to catch up on it. And then after the session, what happens is when each attorney does the summaries for their acts, the initial version of that creates a form for our office that tracks things like rulemaking, study committees, statutory repeals, things like that. So we have reports. So we have an idea of what's coming. And when that happens, I'll update the rulemaking authority chart as it comes in. So probably at our next meeting, if assuming things don't get surprisingly busy, I should have an updated chart for you to review. And then later in the summer, maybe in June or July, I'll have a chart that incorporates the 2025 session.
Yeah, so at the next meeting, we'll have a copy. And I thought this committee could start having a conversation about how we want to, what we want to do with that information that's there. Okay, whether we want to take that on and reach out to departments and agencies that may not be meeting the requirements that we see are there, or whether we want to turn back to community jurisdiction and say, this is what we determined, what would you like to do? Now, of course, you go out of session, that becomes problematic, but I'd like to have a conversation about how we want to use this. It makes no sense to do all this work and not utilize the information that's there. So we'll take it up next week. Any other comments? All right.
Thank you.
With that, we're adjourned. Thank you very much. We're on next week, 2 rules right now. We're also scheduled the week after, which is the 29th. We have 5 rules that day. As I told Emery, he's going to let the folks that are on that on the 29th. It's to be decided. In other words, right now it's on. I don't know how the session's going to wind down. So forewarn them that we might go to the following week and not be the 29th. So I know it's going to be kind of crazy to get down to it.
Did you want to discuss this?
Oh, you do have a copy of a meeting schedule, proposed meeting schedule for off session. My recommendation is to look at that. And if you have dates there that don't work for you, I'm asking you to send that to Emery. He'll collect that. And then Emery and I can get together and talk about whether we want to modify the schedule. Okay, rather than wait till we get there, Fred. So it's understanding that things do change.
Yeah.
It's good. All right, thanks a lot. Appreciate it.